Hi, I am Dr. Jacqui Mack-Harris. I am a licensed marriage and family therapist. I have a private practice in Brea and Murrieta, California. I'm an associate professor at Hope International University, and I'm currently doing a study on imposter syndrome. And so today I get to talk to you a little bit about my ideas about imposter syndrome. I want to share a little bit about how it affects people, how it shows up in our lives, and why I think that it's such a problem. What I've learned is that people identify as experiencing imposter syndrome, and that then means that they feel like a fraud or a fake, or somehow they don't deserve to be where they are. And there's this fear that if anyone really knew, if anyone ever really found out the truth about them, they wouldn't like them, or they wouldn't hire them, or they wouldn't keep them around. And what I've been learning is that most of the time, the imposter isn't in the achievement. It isn't in the role we perform. It isn't in the job that we do or the class that we teach. It's not that we aren't well trained or haven't actually achieved whatever status it is we're finding ourselves in. I think the truth of imposter syndrome is much deeper. It is a core issue. It is more of an issue of who I believe I am. And because so many people don't take time sitting with themselves and understanding who they are and why they choose what they choose and why they do what they do, they don't really know themselves. Another problem is that people are doing what someone else has told them they should do. And so maybe someone decided to go to college to be a doctor because their parents told them that that's what would make them proud. And they hate it. They hate being a doctor. They hate doing patient care. But they feel so awful for saying those things. And so instead of actually acknowledging that they are dissatisfied with what they're doing, they live in fear that someone might find out that they shouldn't really be doing it. It's not about their capacity to do the job. It's about really their thinking, what's happening in their mind, and the thoughts that they are having are contrary to the work that they're actually doing. And so they feel imposter syndrome. And if you are posing, if you are being an imposter in some way, then it stands to reason that you're going to feel imposter syndrome. And so what I want people to learn is that part of becoming who you are is spending time getting to know who you are. Think about your thoughts. Think about why you think the way you do. Think about the work that you do and why it's meaningful to you or why it isn't meaningful to you. Give yourself time for reflection, and so that you can look back over the course of your day and know what parts of it you learned something from, or what parts were hard and that you maybe need to sit and grieve. Be present in your life with yourself so that you can get to know who you are. And as you become more attuned and connected with yourself and are a better integrated person, that imposter syndrome subsides. Most of the time, people feel imposter syndrome because they are performing life as an imposter. And that can come in different ways. So as I said, it can come from the way you think about yourself, or the fact that you're doing something that someone else has put you in and it isn't really your desire. Or that you have begun to believe lies about yourself. And so that's the third problem that we're finding, is that people have begun to believe things about themselves that are not true, from wherever those negative voices are coming from. And believing those voices are not true causes you to feel imposter syndrome, because you are this negative, bad, weak, whatever negative context you come up with, whatever the negative cognition is, whatever those negative thoughts are, you've begun to believe those things. And so when you're walking into your life as a teacher or a doctor or as a wife or a husband or a pastor or whatever the thing is you're doing, that old voice, that lie voice, that negative cognition taps you on the shoulder and says, you know, you really shouldn't be here. You know, you don't really have a right to this. If anyone really knew how you think and who you are, they knew the truth, right? We have all those voices that are coming at us to discredit us, and that is just there to tear you down. It doesn't serve you well. And so what I've been encouraging my clients to do is to spend some time with themselves, getting to know themselves. And some may have heard me ask these questions before. I have these 4 questions, mindfulness questions. What do I feel? Where do I feel it in my body? Why do I feel that way? And what do I need? And asking these questions of myself daily allows me to learn my own language. I now understand what it means to feel this emotion, understand how I feel it in my body, understand why that feeling arises, and I have a better understanding of what I need. I'm now moving according to my own truth and my own experience rather than going to someone else and saying, I don't know what's going on, tell me what to do. And there are a lot of people in the world out there who will gladly do that, but then they expect you to do it. And if it doesn't fit, then what? I think we serve ourselves better to take a look at our own feelings, get to know ourselves, learn to listen to our own bodies, learn to listen to our hearts, and learn to connect with that in such a way that when I step into a classroom or I sit down in my therapy practice and that negative voice comes up that challenges my belonging, that I know me well enough to speak back against that, to be able to say, no, this is me, this is truly who I am. I was made for this. My daughter said that about something the other day, and it gave me such warmth because I knew in that moment that she knows herself. She knows she was made for that. She has a great mind. And so I desire that for everyone. I think that we would be a much more pleasant people if we were better integrated as individuals and didn't have so much fear around someone finding us out. So let's put the imposter syndrome to bed and spend time becoming the you that you were meant to be. And the best way to do that is to spend time getting to know yourself in the way that you would someone else that you love. New Life is here to help and to help you heal. And reach out, give us a call, go to the website, the number is there for you. Give us a call if there's anything we can do to help you. If there is a space in which you find yourself showing up feeling the imposter syndrome, reach out. We've got lots of great programs and lots of great books and studies that can help you move through getting to know who you are and just becoming a better version of yourself.